as the main function of the kidney is filtration of blood, it is important that we understand how the blood is supplied to the kidney itself. This picture shows clearly the blood in and out of the kidney. It's a little complex picture, so we can talk through that. What we are seeing here is a red portion, which is the blood coming in, the arterial blood or arteries, and then the blue portion, which is the venous system. Of course, this is a representation to make you understand it. In reality, they are both present at the same time. So blood enters the kidney through these interlobular arteries, which travel from the hilus towards the cortex. As they reach the cortex, they turn and make an arc, and then from on, they are referred to as the arcuate artery, or coming back, they were referred to as the arcuate vein. All the blood supply then is from these arcuate arteries, which are going upwards into the cortex, referred to as the interlobular arteries. From there, the blood is supplied to the glomeruli, here G1, G2, G3, as well as all the other associated structures, including the capsule here, the capsule capillaries here, as well as in the medulla, which we refer to as the medullary plexus, which form overall vasa recta. So all this complexity of blood vessels then bring the blood back into these interlobular veins, for example, and then into the arcuate vein, and then out into towards the hilus and out of the kidney. So that's a simple way of looking at how the blood flows in and out of the kidney itself. Just to make you understand a little bit better in terms of its landscapes as to where these events are taking place, this diagram would help you. So if you divide this in a medulla and a cortex portions, and then have the interlobular artery, in this case being colored pinkish red, entering, and then how it's going through different portions of the kidney, and then supplying all the individual components, and then the blood flowing out of those, and then eventually ending up into lobular vein and out. So spend some time thinking about and understanding this flow so that you can understand how the kidney actually functions overall. So now we have finished with the kidney itself. We now moving the urine away from the kidney, and the first portion of that where it happens are the ureters. So the urine that is collected within the kidney in the minor and major calyces, and then is emptied into a ureter per kidney. Ureters are muscular tubes, and they are lined with transitional epithelium. You heard that term before, and you know that transitional epithelium is unique to the urinary system, which includes renal pelvis, ureters, bladder, and urethra as well. And sometimes it's also referred to as the urinary epithelium because it's only seen in the urinary system. Similar to other tubular organs, the epithelium has underlying lamina propria, and then it has 2 to 3 layers of smooth muscle. So what we are looking at here are just these portions here, the ureters. Histologically, you will be looking at a picture like this. So you can see the lumen of the ureter, and then the muscular structure on the outside, as well as adipose tissue. These are just more representations of a similar structure. the epithelium and the smooth muscles as well as blood vessels on the outside here. You will be studying this in the lab, so we don't need to elaborate on that any further. Subsequently, the urine enters the bladder. It's the outer portion of the bladder projects into the pelvis cavity and is covered by serosa, and other portions may be covered by connective tissue adventitia. The bladder itself has a thick and layered smooth muscles and is served by either parasympathetic system, which is activated by stretch receptors, which stimulates contraction of these muscles to cause voiding, as well as sympathetic nervous system activation by the stretch receptors, which stimulate the internal sphincter contraction. So this is, you will learn in physiology. So lining is of transitional epithelium, as a stratified epithelium which appears cuboidal in a contracted state. So this is, you have learned before, transitional means it either appears as a cuboidal or it appears as squamous, depending on whether it's in a relaxed state or a stretched state. The cells are able to greatly increase their surface area by unfolding these extensive invaginations of the plasma membrane, which is the hallmark of the transitional epithelium. This is a slide that you will be looking at in the lab. You can see the epithelium here. So this will be the lumen of the bladder. This is the wall of the bladder, where you see a number of different layers of smooth muscles running in various directions, because bladder does not have a linear structure. So when you see this in the lab, pay some attention and look at these cross sections or longitudinal sections, in other words, plane of sections of smooth muscles, to appreciate that. So once urine is voided from the bladder, it travels through the urethra and to the outside of the body. The urethra in the male and the female differ slightly. They are obviously both leaving the bladder, and they have a short segment which at that stage is still lined with transitional epithelium. In the female urethra, the tube is rather short and it terminates in a vestibule superior to the vagina. The epithelium goes through, then changes from transitional epithelium into columnar or cuboidal, and then eventually to stratified squamous as it approaches the urethral orifice and for voiding. In the male, the urethra is seen here, serves as a duct for both the urinary system as well as the reproductive system, with several different portions with varying structures. We won't talk about that in this particular video because we'll be covering that in a little more detail in the male reproductive system, which will be the next histology section. But here you notice the point, the area has been pointed as corpus spongiosum, as well as some of the glands which present near the urethra, providing lubrication for voiding. So this ends the histology structure of the kidney and associated structures, and anything that you would like to elaborate on, feel free to talk to the lab instructors for further clarification.